When you look at information presented by the Bale-Donine method, the standard of care is probably not adequate for most patients.
The current standard of care is missing too many patients, and all of us have had patients who've gone through the typical cardiology workup only to have something bad happen in the months following that.
If you were to look at any cardiac care unit right now, people who come into the hospital with an acute coronary event or a stroke, many of them will have normal lipid levels and meet all the guidelines, yet they're having an event.
Most patients see their physician maybe once or twice a year for 6 to 8 minutes. And if their cholesterol is high, maybe they'll be told to watch it and we'll see what happens, change your diet. But they're really not looking and assessing that patient for their risk factors.
We are just scratching the surface of prevention, and we're not really even doing that. I mean, it's really a pitiful effort what the standard of care is.
Our current state of care for heart attack and stroke is substandard, and we've accepted that. We've accepted that mediocrity, and unfortunately none of us want that mediocrity to happen when we're taking care of your father, your mother, your sister, your brother, your child.
My current perceptions of the standard of care in cardiovascular stroke prevention is that I think it's dismal, and I see patients put on medications that I've since learned in this course, no way should they be placed on.
We understand all the different things that allow atherosclerosis to occur, but what are the things that actually cause an event to occur that can either change their life or take their life? By identifying these risk markers, I think we'll be able to help our patients more, and they'll be able to see with that how much more important these things are now.
The standard of care typically looks at traditional risk factors, high blood pressure, cholesterol levels, diabetes, but the Bale-Donine method is a disease-based paradigm. It looks and identifies the presence and extent of disease, and then it assesses the state of the disease.
Most of us tend to just look at a standard lipid panel, or if we're really pretty, advanced in our thinking, we may get a VAP cholesterol test and look at the LDL particle size. So most of the focus has been on the LDL cholesterol number and particle size. But there are so many more risk factors for heart disease that we have overlooked.
I've seen doctors who just throw up their hands at people's blood pressure and cholesterol measurement, complete lack of understanding of inflammation and blood sugar as the underlying causes of cardiovascular disease and as the essential things that need to be addressed. So there's a huge gap in knowledge between the doctors who practice standard of care and optimal practice of heart and stroke prevention.
So I think we need to raise that level much higher, and this method brings us way up into the current standard of care. This should be the standard of care, there's no doubt in my mind. I think we've accepted mediocrity for way too long, and I think this changes everything.